of specialization is the main reason. If you go to an orthopedic urgent care, you're going to see an orthopedic specialist. So if you've got a bone, joint, muscle problem, if you go to an orthopedic urgent care, you're going to see someone who subspecializes in that problem. If you go to a regular urgent care, oftentimes you'll see a provider that deals with sore throats, chest pain, other types of problems that aren't specific to the skeletal system, and their level of expertise is probably not what you're going to get if you go to an orthopedic urgent care. You'll see an orthopedic surgeon or orthopedic PA or orthopedic nurse practitioner that the only thing they do is orthopedics. Much the same as going to another urgent care. I think that level of specialization. If you go to the emergency room, you're going to see typically an emergency room physician or an emergency specialized physician assistant. And the musculoskeletal system is not their most pressing concern typically. They have a basic idea of what can go wrong with the skeletal system, but not to the level that an orthopedic surgeon or an orthopedic physician assistant or orthopedic nurse practitioner would have at their disposal. I think that you typically save quite a bit of money as well by going to an orthopedic urgent care. It's typically an office visit versus what you would pay for an emergency room visit. I think your insurance company typically would prefer that you go to orthopedic urgent care because it's less costly. And oftentimes you end up having more visits if you go to an emergency room because they're going to send you to the orthopedic surgeon after that visit anyway. It's basically just to triage the patient, make a diagnosis, give them some basic pain medication if they're in enough pain to require that, and send the patient on their way. I think the benefits of an orthopedic specific urgent care as well is that you're not exposed to some of the potential infectious things that you see in the emergency room. You're in the waiting room and people are coughing and they've got potential communicable diseases that you won't be exposed to in an orthopedic practice. Well, we're available Monday through Friday, our typical office hours. I think that if it's causing enough pain and disability or concern on your mind, we're able to get you in very quickly, walk-ins. You can call and schedule an appointment a few hours or end of your day. So anytime's a good time to come to our office and we get you right in and tell you what's wrong and create a treatment plan that can get you back on your feet.